welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and here is what we have from the world of medicine. Ginger supplementation may relieve persistent symptoms in hypothyroid patients with normal thyroid-stimulating hormones. Primary hypothyroidism is a common disease with a prevalence of 1 to 2%, with 5 to 8 times greater prevalence among women. Some patients have persistent symptoms despite normal serum thyroid-stimulating hormone levels. However, preliminary results of a recent study suggested that ginger supplementation can help relieve persistent hypothyroid symptoms. The Food and Drug Administration recognizes ginger as a safe dietary supplement, and recent studies have shown that protective effect of ginger against the thyroid damage in animals and humans has been proven. According to preliminary results, ginger supplementation can definitely relieve the persistent hypothyroid symptoms. Also, it may have beneficial effects in terms of weight reduction as well as re-regulation of the fasting blood sugar and the lipid profile in such patients. Is estrogen protective against the risk of brain shrinkage? Estrogen is a kind of hormone that has a very important role in the health of a woman, and its role is not only as a reproductive hormone but also several other aspects are being explored nowadays. A recent study published in the journal Neurology, which is the medical journal of the American Academy of Neurology, has revealed an association between more estrogen exposure over a lifetime to greater brain volumes as well as the fewer indicators of brain disease on brain scans, specifically in midlife. Reproductive history events signaling more estrogen exposure, including longer reproductive span, premenopausal status, use of hormonal therapy, as well as contraceptives and a high number of children. The study reported associations between the indicators of estrogen exposure from a woman's reproductive history as well as a brain MRI biomarkers of Alzheimer's disease in midlife are promising. Atrial shunt device might not reduce heart failure in patients. Cardiac death is a serious issue that needs to be managed. More than 1/2 of people with heart failure have a preserved left ventricular ejection fraction. Now, placement of an intra-arterial shunt device to reduce the pulmonary capillary wedge pressure during exercise in patients with heart failure as well as an preserved or mildly reduced ejection fraction. According to a recent trial, which is the Reduce LAP HF2 in the Lancet, reported that placement of an atrial shunt device did not reduce the total rate of heart failure events, or rather even improve the heart status of the overall population of patients with heart failure and ejection fraction of greater than or even equal to 40%. Stress factors to accelerate biological aging. Stress is the body's reaction to a challenge or even demand. In short bursts, it can be positive, such as when it helps you avoid danger or even meet a particular deadline. But a prolonged stress can be dangerous and can have adverse effects on our health. Chronic stress, on the other hand, is linked to negative long-term health consequences, raising the possibility that stress is related to accelerated aging. The study reports cumulative stress was associated with an accelerated grim age and stress-related physiological measures of adrenal sensitivity as well as insulin resistance. The study, published in the journal Translational Psychiatry, concluded that cumulative stress is associated with epigenetic aging in a healthy population, and these associations can be modified, or rather are modified, by biobehavioral resilience factors. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.